Candidiasis, also known as a yeast infection, is a common condition caused by a fungus called Candida. This fungus lives on our skin and inside our body, usually without causing problems. However, overgrowth can lead to infections in different parts of the body, ranging from mild to severe. Some people may experience recurring infections. Understanding candidiasis and knowing how to manage it is crucial. It affects people of all ages and health conditions. Recognizing its symptoms and knowing when to seek help is important. In this video, we will explore the types, symptoms, risk factors, diagnosis, treatment, and prevention of candidiasis. Early detection and treatment can improve quality of life and prevent complications. Let's start by looking at the different types of candidiasis. Stay tuned to learn more. Candidiasis can affect various parts of the body, including oral, genital, cutaneous, esophageal, and invasive candidiasis. Oral candidiasis, or thrush, causes white patches in the mouth. Genital candidiasis causes itching and irritation. Cutaneous candidiasis affects the skin, causing red, itchy rashes. Esophageal candidiasis causes pain when swallowing. Invasive candidiasis is the most severe form, spreading through the bloodstream. Each type requires different treatments. Recognizing the type guides appropriate treatment. The symptoms of candidiasis vary depending on the type and location of the infection. Oral candidiasis presents with white, creamy patches on the tongue and inner cheeks. People may also experience a cotton-like feeling in the mouth and pain while swallowing. Genital candidiasis in women causes intense itching, burning, and redness. Men may experience itching and a rash on the penis. Both men and women can feel discomfort during intercourse or urination. Cutaneous candidiasis shows up as red, itchy rashes in skin folds. Esophageal candidiasis causes difficulty in swallowing. Invasive candidiasis symptoms include fever, chills, and septic shock. Early detection and treatment can prevent complications. Certain factors can increase the risk of developing candidiasis. One major risk factor is the use of antibiotics, which can disrupt the natural balance of bacteria in the body, allowing Candida to overgrow. A weakened immune system is another significant risk factor, making individuals more susceptible to candidiasis. People with conditions like HIV, AIDS, cancer, or those who have undergone organ transplants are at higher risk. Diabetes is also a risk factor, as high blood sugar levels can promote the growth of Candida. Pregnancy and hormonal changes can increase the risk of genital candidiasis in women. Hormonal birth control methods can also contribute to this risk. Managing these risk factors can help in preventing candidiasis. By being aware of these risk factors, individuals can take proactive steps to reduce their likelihood of developing candidiasis. Let's move on to how candidiasis is diagnosed. Accurate diagnosis is essential for effective treatment. Understanding the diagnostic process can help you seek timely medical advice. Stay tuned. Diagnosing candidiasis involves medical history, physical examination, and lab tests. It starts with a detailed medical history. Then, a physical examination follows. For oral candidiasis, white patches are checked. For genital or cutaneous candidiasis, redness and rashes are examined. Lab tests confirm the diagnosis. Samples may be examined under a microscope. Accurate diagnosis is crucial for effective treatment. Consult a healthcare professional for proper diagnosis. Treating candidiasis involves various approaches depending on the type and severity of the infection. Topical antifungals are often used for mild cases, applied directly to the affected area. For oral candidiasis, antifungal lozenges or mouth rinses are commonly prescribed. For cutaneous and genital candidiasis, creams, ointments, or suppositories are used. Oral antifungals are used for more severe or recurrent cases, taken by mouth and working throughout the body. Common oral antifungals include fluconazole and itraconazole. Intravenous antifungals are used for serious cases like invasive candidiasis, administered through a vein in hospital settings. Managing underlying conditions is crucial, such as controlling blood sugar levels in diabetics and strengthening the immune system in immunocompromised individuals. Lifestyle changes, such as maintaining good hygiene and avoiding irritants, can also support the treatment process. Following medical advice and completing the prescribed treatment can effectively manage candidiasis. Early intervention and appropriate treatment are key to preventing complications. Let's now discuss prevention tips. Preventing candidiasis is better than treating it. Stay tuned for practical tips to reduce your risk. Prevention is always better than cure. Let's move on. Preventing candidiasis involves adopting healthy habits and managing risk factors. Good hygiene is essential, such as regularly washing the affected areas with mild soap and water. For oral health, brushing teeth twice a day and using mouthwash can prevent oral thrush. For genital health, wearing breathable, cotton underwear and avoiding tight clothing can reduce the risk of genital yeast infections. Avoiding excessive use of antibiotics is important, using them only when prescribed by a healthcare professional. Managing underlying health conditions, such as maintaining optimal blood sugar levels for diabetics, is crucial. Using probiotics can help maintain the natural balance of microorganisms in the body. Consuming probiotic-rich foods like yogurt, kefir, and sauerkraut can support gut health and prevent yeast overgrowth. Probiotic supplements are also available and can be taken under the guidance of a healthcare provider. By adopting these preventive measures, individuals can significantly reduce their risk of developing candidiasis. Prevention is always better than cure, and small lifestyle changes can make a big difference. Let's now discuss the importance of consulting healthcare professionals. Professional advice is crucial for effective management. Stay informed. Consulting healthcare professionals is crucial when dealing with candidiasis. Self-diagnosis and treatment can often lead to complications. Healthcare professionals have the expertise to accurately diagnose candidiasis and prescribe appropriate treatment. Misdiagnosing a yeast infection can lead to ineffective treatment and prolonged symptoms. Professionals can also identify underlying conditions that may be contributing to the infection. Addressing these underlying issues is essential for effective treatment and prevention of future infections. Following a healthcare professional's advice ensures that the correct treatment is used. Over-the-counter medications may not always be effective, especially for severe or recurrent infections. Regular follow-ups with a healthcare provider can help in monitoring the condition and adjusting treatment as needed. Ongoing medical support can help in managing symptoms and preventing complications. Seeking professional medical advice is essential for the effective management of candidiasis. It ensures accurate diagnosis, appropriate treatment, and ongoing support for preventing future infections. Let's now move on to practical advice on managing candidiasis. Managing candidiasis involves a combination of medical treatment and lifestyle changes. Follow the prescribed treatment plan diligently, taking all medications as directed by your healthcare provider. Do not stop the treatment early, even if you start feeling better. Completing the full course of medication ensures that the infection is completely eradicated. Maintain good hygiene to prevent the spread of infection. Wash the affected areas regularly with mild soap and water. For oral thrush, brush your teeth twice a day and use an antifungal mouthwash if prescribed. For genital yeast infections, wear loose-fitting, breathable underwear and avoid using scented products. Make dietary changes to support your treatment, such as reducing sugar intake and including probiotic-rich foods in your diet. Stay in touch with your healthcare provider for regular checkups and report any new or worsening symptoms promptly. By following these practical tips, individuals can manage candidiasis effectively. Combining medical treatment with healthy lifestyle choices can lead to better outcomes and prevent recurrent infections. Let's conclude our discussion. Stay informed and proactive in managing your health. Candidiasis is a common yeast infection that can affect various parts of the body. Understanding its types, symptoms, and risk factors is essential for effective management. Early diagnosis and appropriate treatment can prevent complications and improve quality of life. Preventive measures such as good hygiene, managing underlying health conditions, and using probiotics can reduce the risk of candidiasis. It is important to consult healthcare professionals for accurate diagnosis and treatment. Self-diagnosis and treatment can lead to complications and prolonged symptoms. By following medical advice and adopting healthy habits, individuals can manage candidiasis effectively. Early intervention and ongoing medical support are key to preventing recurrent infections. Understanding and managing candidiasis can lead to better health outcomes. Stay informed, follow medical advice, and take proactive steps to prevent and treat yeast infections.